My name is Bernadette Colet. I am 35 years old and I live in Digital.
Bernadette, age 35, watering plants outside her home. Inside the house, framed pictures of Bernadette and family. In the kitchen, Bernadette wipes the counter near sink with a small towel. In the living room, Bernadette dusting the living room mirror and counter with a feather duster. Vinnie Colette, Bernadette's mother.
Bernadette was born in October 1977, and it was a very difficult delivery.
Photo of 12-month-old Bernadette sitting on the floor.
But when she was delivered, my doctor told me that she's a Down syndrome child. And I didn't know anything about Down syndrome. So I was really confused. There were a lot of questions that came to my mind.
Photos of Bernadette as a baby appear as Vinnie speaks.
We connected with the Department of Public Health and Social Services. They sent us a social worker that came to our house regularly to offer us a lot of encouragement, offer suggestions on how to stimulate Bernadette, give us suggestion on how to do some exercises, So that was very, very helpful. Then when he was 3 years old, we went home to the Philippines to show my parents about Bernadette and Steve, my son. And my father was very, very encouraging and said, "No, she will walk, she will walk, just be patient with her."
Photo of 12-year-old Bernadette with her grandfather.
So that was a very, very big help for us. The early intervention that was given to us at that time was very, very helpful because we did everything to really help Bernadette exercise. We did a lot of stimulation, talking, trying to expose her to a lot of things in the community. She was very young when she was started school. I think she was about before 4 years old. So I have a structured schedule with her. As soon as I finish cleaning the kitchen or doing my household
Photos
chores,
of Bernadette
we have a
as a
table where
child.
we can sit down together, and we have a lot of materials that I can show it to her in order for her to learn. So there were blocks that, we count blocks, we have shapes, different kind of shapes. And we do that every night, except on Saturday and Sunday. And she remembers. If I don't do that, she would tell me and said, "Mom, I need to sit down with you," So that was really a help for her. She enjoyed going to school. She likes doing her homework. And if she feels that we are not doing or we have forgotten to help her with her homework, she would always remind us. She likes to socialize.
Photo of Bernadette, age 7, smiling
things.
with her friend.
When she was in third year at JFK, I asked the teacher and the counselor if they can start putting her in a job.
Photos of Bernadette
situation
as
so
a
that she can
teenager.
learn. So they put her at Burger King at the Micronesia Mall, and that was the beginning of her work experience. From Burger King, she went to NICU, and she was assigned at the linen room, where she was giving uniforms for the employees, and also she was helping in folding towels and bed sheets. She was only laid off there because of the typhoon. You know. From Nico, she went to Wendy's in Jigo, but that was very, very short. It was a very brief employment because of the economic crisis. So she didn't work after a year, I think. But then she was getting bored, so I went to Guam Memorial Hospital, and I asked them if they could have her as one of their employees, and they said, and I told them that by law, they are supposed to hire people with disability.
Voice of Catherine's Nicholas.
Bernadette has been working with us since last year of
Footage
April.
from Senior Ham Machocho of Bernadette as an employee at the hospital. She picks up her hairnets and a disposable apron and
Our
puts them
perceptions in this department have changed tremendously in having Bernie part of our family. We found that she's just as normal as everyone else. The co-workers
laughing with three
love her
co-workers at
dearly.
the GMH
She's
kitchen.
been a ham to have.
Her duties
Bernadette
include
at work, arranging foam cups under
sanitation,
supervision from John
cleanliness, replenishments, putting things back to where it's supposed to be,
Bernadette restocking
refilling
the
the drinks, keeping the tables clean and neat,
Bernadette wiping
sweeping and
a table
mopping,
and sweeping
just
in
the basic
cafeteria.
things around the cafeteria and the dining area. She was able to perform quite well, actually.
I
Catherine's
believe
Nicholas
Bernie
teaching Bernadette
has
how to
met
use
the
the
expectations
computer.
we have of her, and we didn't compromise. Bernie has tremendous potential.
Bernadette worked at the hospital for more than 3 years, and she really enjoyed it because they become so friendly, very accepting of her. They always remember her birthday because she always tell them. She always
Bernadette
tell
standing
them,
in front of a
"Well,
table of
tomorrow's
food,
my birthday,"
celebrating her
so they
birthday
will
with her
always
fellow
celebrate her
employees.
birthday. She loves working. She will get up so early. She's very punctual at work. She doesn't like breaks. She's bothered with employees who have long breaks. She's a very, very good worker.
Being parents of
Rudy
a child
Collette,
with,
Bernadette's father.
developmental disabilities is a very challenging responsibility. One thing that I have observed in the community is that there is always
Photos of Bernadette
an
at various
an
ages appear.
obstacle for children like her to be integrated into community because many people up to now they still lack the knowledge of understanding the nature of a person who has a developmental disability.
My advice to teachers who are going to work with children with disabilities is to be creative, be flexible, consult your fellow
Bernadette,
teachers,
age 35, sitting
consult
next to
your
her mother and
principal,
holding her
consult
hand.
the consultants in school, but most especially work with the parents.
Bernadette
or
with her
involve
parents
with the
posing
parents
for a
because
family
they are
picture.
the ones
Bernadette
who
and parents
know
are smiling,
the needs
looking towards
of
the
their
camera.
children, and also be patient because the course that you finish in school is just a tool or just one of the guidelines that will help you in your teaching profession. But I tell you, there are children with disabilities are fun to work with, and they can learn, and also have fun, you know.
Bernadette laughing. Words appear. Bernadette. Special thanks to the Colet family. Bernadette Colet, Rudy and Venny Colet, Red Stephen Colet. Special thank you to Guam Cedars Advisory Council. Credits appear: Director Terry Farron, Camera Sean Azama, Keith Villaluna, Editor Sean Azama, Production Crew Terry Farron, Sean Azama, Keith Villaluna, Transcription Margaret Johnson, Producer Terry Farron, Executive Producer Heidi St. Nicholas, PhD, Guam Cedars Director. UOG and Guam Cedars logo appear. Copyright 2014. This film was produced with 100% funding supports from the U.S. Department of Health and Human Services, Administration on Developmental Disabilities, grant number 90DD0014-01-00, and facilitated by the University of Guam Center for Excellence in Developmental Disabilities, Education, Research, and Service, Guam Cedars.